Dr. John Torres, Dr. John with NBC News here with this Facebook Live, talking about things you might have heard over the last week or the last weekend, particularly things related to coronavirus and the pandemic. Get below the headlines so you have a better understanding of what that means, not necessarily just for you, but for your family and your loved ones, and hopefully send you home with some tips that you can use to try and get through this pandemic a little faster, a little safer, and hopefully we can all use this information to end it a bit earlier. And then I'll answer any questions that you might have. So if you have questions, please send them our way. I'll get to as many of those as I can. But we just finished the Thanksgiving weekend, so a lot of people traveled. As a matter of fact, they said this year 6.8 million people traveled that week before Thanksgiving, including the Thanksgiving holiday time frame. That's a lot more than they thought would travel. And before people started traveling, experts are putting out the message, don't travel this weekend. This is one Thanksgiving. We all need to stay put. We all need to stay home. And we all need to stay as safe as possible. The reason they didn't want people to travel is because we know once traveling starts, a few weeks after that, we start seeing increases in cases. And I'll talk about the case numbers we're seeing right now in a little bit. But we're expecting over the next couple weeks to see higher numbers of cases. And here's what we've seen in the past. Memorial Day, July 4th weekend, Labor Day, all those weekends. After that, we noticed spikes in cases across the country. Well, this weekend's a much bigger traveling holiday weekend than those were. And so the concern is that is going to happen. And we think we are going to see increases in cases. Now, one of the reasons behind that is we know that what we used to think of were these large gatherings were the things that were driving the pandemic. Now we know these smaller gatherings, including bars and restaurants, and people's gatherings in their homes can also increase the amount of coronavirus that's out there and the spikes in cases. And so for this holiday traveling, the question now is, if you return home, should you get tested or what should you do? And a lot of experts are weighing in and kind of with different messages to a certain extent. But if you look at all their messages, they're saying essentially the same thing. So the thing with coronavirus, it has a 14-day incubation period, meaning that once you get infected, up to 14 days later, you can have the virus and start spreading symptoms at that point, because the virus has to build up in your body at a certain point. Once it gets that certain level, then you can start getting the virus out of your body, getting it across to other people, and they can start getting the virus, and that's when it's contagious. And so again, after getting infected up to 14 days later, you can develop that contagious state. And so that 14-day quarantine period is important. But here's where the message differs a little bit. Some experts are saying, including the government, are saying, if you went somewhere and you came back, go ahead and quarantine for those 14 days. Others are saying, if you're in a high-risk environment, go ahead and quarantine. In other words, if you were in a small group, even if your family members that you didn't live with on a regular basis, and you took down your mask, you didn't social distance, even for a short period of time, then you need to quarantine when you get back to make sure it doesn't spread to other areas. On top of that, you have to look at your state and local regulations, because the guidelines might have you quarantine as well. And I know some areas are changing those a little bit. New York, for example, had a 14-day quarantine period. Now they're going more towards a testing and quarantine period that is much shorter to try and get people to make sure they do that, because they're having a hard time enforcing the quarantine. But if you decide to get tested, you don't want to get tested today or tomorrow or even the next day. You don't want to get tested right after you get back, because again, that virus hasn't built up in your body enough to where you're going to start showing it on tests. And so what you want to do is get tested somewhere in a 5 to 10 day period. That is your optimal window to find out if you can test positive. That's going to give you the biggest bang for your buck. If in that 5 to 10 day period after you get back you test positive, then you definitely need to isolate yourself, because you have coronavirus. You need to be careful, and you need to phone back to the people you're with and say, unfortunately, I have coronavirus. I probably got it at that small gathering. Everybody needs to be careful. The other thing to remember is not to get tested too early, and especially not to get tested with the rapid tests that are out there if you're not showing any symptoms, because those tests are not as accurate if you're not showing symptoms. You want the PCR test for the most accuracy. But here's the caveat. Even if you test negative at that 5-day point, let's say you test negative at the 5-day point, that doesn't give you a free pass to do whatever you want beyond that 5-day point, because remember, that 14-day time period is still the incubation period. And you might have seen a graphic that was out over the weekend, and they were using an example of somebody who essentially got infected day 0. On day 5, this is a hypothetical person, on day 5, they hung out with friends. On day 8, they started coming down with symptoms and got tested and found out they were positive day 10. And they ended up contaminating, passing coronavirus on to 22 people, because at that day 5, they were feeling fine, but they were spreading the symptoms. And even though they tested at day 8, still at day 10, they came up positive. So again, it's one of those things you want to remember. that even though you test early, it might not be enough. You want to go that whole quarantine period of 14 days. And so that's testing itself and the holiday travel. Again, we have other holidays coming up, and so the same thing is going to happen here. We need to make sure that during this holiday season, we don't travel any more than we necessarily have to, because that essential travel is the only thing we should be doing, because otherwise we'll be spreading a virus. This is one holiday season. I know I was the same one that had to tell relatives no, they couldn't come here. We want to make sure that we all stay safe and we keep each other safe as well. Number 2, vaccines. So the vaccine's the second headline. You might have heard a couple of things over the last week or so. 2 vaccines right now have submitted their paperwork for emergency use authorization. Pfizer did it a week ago. Pfizer submitted their emergency use authorization paperwork to the FDA, and they're saying it looks like theirs is around 95% efficacious, meaning that when they looked at the study, it protected people at the 95% level. Moderna, which is the other one coming along, is submitted their paperwork today, and they're saying 94.1, which is very close to 95%, so they're in the same ballpark. The difference between the two is Moderna is one that for 30 days can last in regular refrigeration, the temperatures your own refrigerator at home is. The Pfizer one needs to have that ultra cold refrigeration, which is minus 70 degrees centigrade, minus 94.4 Fahrenheit. And so that is out there right now, and they're getting a lot of those ultra cold freezers in different areas, but it's going to be hard to get it down to the level where I think a lot of people are going to have access to it. So it'll be interesting to see who gets access to what vaccines. So what's happening now is the FDA is going to look at it with this emergency use authorization. They're meeting December 10th to look at the Pfizer one, December 17th to look at the Moderna one, because they need time to crunch the data and understand what's going on with it. Once they get through that data, then they're going to go ahead and decide whether to go ahead and give their emergency use authorization. They have a committee meeting called the VRBPAC, who gives them essentially the thumbs up or the thumbs down, and they usually follow the recommendations of this VRBPAC committee. And then they'll say, okay, we're giving an emergency use authorization. Not an approval, which is permanent, but an emergency use authorization, which is a temporary authorization to use the vaccine. And then the CDC will convene what's called the ACIP, the Advisory Committee on Immunization Practices, and that committee will determine, okay, who gets it, at what dosing, and how's it distributed. And once those two, the CDC and the FDA, do that, then shots will start being put into people's arms at that point. Most experts think that the shots will start happening a little bit after Christmas. And this is a lot earlier than we thought would happen, but that's great news. But again, it's going to be phased in. Not everybody can get it on day one, so it's going to be phased in for certain people on certain days. Both vaccines are 2-shot vaccines, which means you have to get one and a few weeks later get a second shot. But we think this shot will help people protect them from coronavirus over the next few years and not necessarily require a yearly booster. But only time will tell that. But this vaccine, again, is one of the things that's going to help us get the pandemic under control. Not the only thing, but one of the things. We're still going to need face masks. We're still going to need social distancing until we get that herd immunity to a high enough level that we can get the pandemic under control, we get the virus under control, and then we can start getting back to what our lives were before. My thought is that probably come summertime frame, we'll be seeing essentially a close to normal type of life that we haven't had over the last year. But the vaccines are both coming, and they're both coming fairly quickly. And again, the CDC or the FDA is meeting December 10th to look at the Pfizer vaccine, December 17th to look at the Moderna one. Other vaccines are following very closely. You might have heard about the AstraZeneca Oxford vaccine, that they're also looking at that data. That had a few stumbles over the last week because some of their data was confusing. They said in some cases it was 62% effective, other cases it was 90%. The confusing part was the 90% came if they gave people half doses, which they did unfortunately accidentally because they had mixed up the manufacturing of the dose, and they found out that half dose worked better than a full dose, which is very strange to say the least. And so a lot of experts are looking at it going, we need more information. The nice thing about this is the FDA, Dr. Hahn from the FDA told me personally that they're not going to authorize anything until they get all the information, and once they get the information, it's transparent, and so other experts will be looking at it as well. So look for that over the next couple weeks, people giving input into what they think about this vaccine. But overall, most experts that I've talked to have said this vaccine looks a lot better than they thought it would. The safety profiles look good, so it looks like it's safe and effective, which is good going forward. And so more than likely we'll be getting it here sooner rather than later, which is a good thing. And it's a good thing because of the numbers we're seeing right now. And if you look at the numbers, they have really jumped up over the last few weeks. And here's the way it works, and that's why they're concerned us with the holiday travel. Think of everything happening in 2 weeks. So if people got infected over the holiday, 2 weeks from now, so we're talking first week and half of December, you're going to start seeing an increase in cases. 2 weeks after that, you're going to start seeing an increase in hospitalizations. And 2 weeks after that, you're going to start seeing an increase in deaths, unfortunately. And right now, we're seeing increases in hospitalizations based on the cases we saw a couple weeks ago starting to creep up. And if you look at the way cases are across the country, I just want to run through a couple of things here. It's hard to tell sometimes because when you look at populations, obviously the United States is much bigger than the United Kingdom or Germany. Brazil and India are much bigger than the United States, and so it's hard to do just plain numbers, so I'm going to do it by 100,000 people. And if you look at the United States, they had 51 cases per 100,000 people yesterday. 51 cases per 100,000 people. If you start going down the list, Italy was next in line, 48 cases per 100,000. And I just picked different countries here. United Kingdom, 26 cases. Germany, 21 cases. So they're up there about half of what we are. And then you get Brazil, 15 cases per 100,000. So they're doing very well. And remember, this is a giant country with a lot of people. India, 1.3. They have 4 times the population we have. They have 3 cases per 100,000. And people would argue that India is a first world country that has some developing areas to it. And so their hygiene methods aren't as effective as ours. Their public health infrastructure isn't as effective as ours. Yet they're keeping their coronavirus much, much better under control. The common denominator among all these is the fact that they basically are doing more of those things, the social distancing, the staying at home, the wearing masks, those things we know that could certainly help. And so again, we're seeing those numbers creep up. We're seeing the numbers, particularly across the world in different countries, creep up. Unfortunately, the United States is still leading there for some of the cases, some of the deaths, and we need to get that better under control. The concern is it's not going to be right now. We're going anywhere from, we got almost up to 200,000 cases per day. Now we're down about 130, 140,000 cases per day. Concern is after Thanksgiving, we're going to see close to 300,000 cases per day, so we need to be very, very careful with all that. But again, looking at the headlines, number one, we talked about holiday travel. When's the best time to get tested? 5 to 10 days, but even if you're negative, you still need to watch yourself for the next few days to make sure a total of 14 days of quarantining, which doesn't necessarily mean staying in your house, but staying away from other people as best you can, wearing a mask, social distancing, those types of things, doubling down on that effort. Number two, the vaccine. The Moderna vaccine, they submitted for their emergency use authorization today. They're going to start looking at that, and December 17th, the FDA will look at it and decide. On December 10th, they're going to decide on the Pfizer vaccine, which submitted its emergency use authorization paperwork a week ago. So it looks like over the next few weeks, we could have 2 vaccines that are very good at this point. Of course, we'll get all the data and look at it then. Number 3 is the cases that are going up. We think they're going to go up even more, so be extra careful, be extra vigilant, and be extra safe. And let me see if you have any questions.
If I'm having flu symptoms, should I go and get tested for COVID-19?
So if you're having flu symptoms, should you get tested for COVID-19? You should actually get tested for COVID-19 and flu, both things. There is a test out there that can test for both. It takes a little while to get back, but there are certainly tests that can test separately. The reason I'm saying this is because initially the flu and COVID-19 seem almost identical. Their symptoms are about the same. Fevers, body aches, just not feeling very good, fatigue, maybe a cough, dry cough, those types of things. They do separate a little bit, and the flu, people say they tend to get hit very quickly, where all of a sudden it comes on very fast and very hard, and they have a hard time getting out of bed, a lot of fatigue, muscle aches, whereas with COVID-19, the symptoms seem to crop up slower, and then they get those unusual symptoms, the loss of sense of smell or taste, maybe abdominal issues on top of that, but the fatigue is still there. And so they start off the same. They certainly can look different as time goes on, but not necessarily. And that's why it's a good idea to test for both. If you test for the flu, if it's early on, there's medicines we can use to treat that. If you test for COVID-19, at this point, there are medicines that probably, if you're not having many symptoms, if they're mild symptoms, probably just let it take care of itself. If the symptoms start getting worse, then look at different things that might work for that. And again, it's such a new virus, we're still learning a lot about it, and we're still learning a lot about the treatments.
Is COVID mutating like the flu?
Is COVID mutating like the flu? Viruses constantly change, and when people hear the word mutation, they think mutation means what they've typically seen in the movies and read in books. that mutation is a big thing, and all of a sudden it's going to completely change the virus, and the vaccines aren't going to work, the medicines aren't going to work, and it's become more virulent, as we say, more attacking with deadlier symptoms. But the truth of the matter is these viruses always undergo minor changes constantly. That's what viruses do, and that's how they survive billions of years. Those minor changes really don't have much effect on how the virus affects us as far as how contagious it is, how deadly it is. But in this case, what we're finding out is it is changing a little bit, but it's not changing to a great extent. As the World Health Organization put it a while back, they haven't seen any significant mutations in the coronavirus, and that significant part is important because when it becomes significant, that's when we worry about the vaccine not working or not working very long. We worry about it being more contagious and possibly more deadly. In this case, we're not seeing that. So we think that it's a fairly stable virus that's going to stay fairly stable. We think the vaccine's going to work well for it and hopefully work for more than just 1 year. Hopefully, most experts are saying we hope it works for the 5-year time period, maybe even a 10-year time period. But it is changing, but not changing significantly.
Are we supposed to get both vaccines, flu and coronavirus?
That's a great question, actually. We're supposed to get both vaccines, flu and coronavirus. Yes, because they're two completely different viruses. And so every year you want to get the flu virus because it helps you make sure that either you don't get the flu or, more importantly, that if you do get the flu, you don't get complications from the flu or you don't get hospitalized or die from the flu. Now, the thing about the flu vaccine itself, it's around 50% effective, which a lot of people say, why bother at that point? But the important part is it's 50% effective at preventing the flu, but it's much more effective at preventing some of those other things, the complications, the hospitalizations, the death from the flu. And so that's why it's important to get. Also, we're finding out that the more often you get the flu shot, the more protected you are from the flu because it primes your immune system to attack the flu, that the flu shot might not be as effective as we'd like it to be. That's the flu vaccine. The coronavirus vaccine, completely different virus. You need to get that because we need to get through this pandemic. And we know now that coronavirus has a certain death rate. Coronavirus has a certain complication rate. Coronavirus has strange complications like the long haulage symptom where people 3, 4, 6 months later are complaining of odd symptoms that have really changed their life because they've gotten coronavirus. So it's not simply a cold that you get and it goes away. It's something that sticks with you and can really cause complications. And that's why you want to get the vaccine and on top of that to help get this pandemic under control. What we don't know is now we know that the flu vaccine you have to get every year because the flu changes enough to where the vaccine from last year isn't going to be as effective as the vaccine from this year on the viruses that are circulating out there. With coronavirus, we don't know if that's going to happen, but we don't think you're going to need it on a yearly basis. We think you're going to need it maybe every 5 years or so, but time will tell. And that's the only way to truly tell is with time. They'll keep monitoring it, looking at the vaccine. If the virus changes, then they'll be able to get on the vaccine, change it, and tell people, okay, we need a new vaccine. Now, the big thing is look for distribution. How's that going to work? Well, both manufacturers have said, and HHS, the Health and Human Services, has said that once that vaccine gets emergency use authorization, once it gets through the CDC for recommendations on dosing and distribution, they're going to get it out there within 24 hours. They want, within 24 hours, people to start getting shots. They're going to phase those shots in. Not everybody can get the vaccine all at once. There's 330 million people here in the U.S. Both these vaccines are 2 vaccine shots, so that's 660 doses needed here in the U.S. What they're going to do is they think by the end of the year we'll have 40 million doses. That's 20 million people that can get it. So they're going to do it by categories. Healthcare workers and those that are particularly vulnerable, like people in nursing homes. What they're wrestling with right now is who goes first, nursing home or healthcare workers. And it's kind of a balance as to protecting the most people you can as early as you can during this pandemic. And so they're going to meet to decide, the CDC to decide how to allocate that. On top of that, the people that are essential workers are going to be in the next phase. Teachers, people out there keeping infrastructure working, those are going to be in the next phase. And then it's going to be the general population. General population, all along I've been saying about April time frame, that might even be accelerated. It might be February, March time frame if they can get enough vaccine out there. But right now, again, the 2 front runners, Pfizer and Moderna, will probably be the ones you're going to see the most around. And my guess is you're going to start seeing people get this vaccine 3, maybe 4 weeks from now. But otherwise, again, going through the headlines real quick, thank you for your questions. Holiday travel, if you did travel, you definitely want to watch yourself for the next 14 days, quarantine yourself. If you get tested, 5 to 10 days after you get back is the optimal time to get tested. But even if it's negative, you can't let your guard down. You still need to make sure you take care of yourself and those around you. The vaccine, we talked about the 2 that are out there, Pfizer and Moderna, both looking for the emergency use authorization, the EUA. And then the numbers. As you can see, the numbers are going higher. The concern is they're going to go even much higher over the next couple weeks as the cases start building up from the holiday travel. But hopefully, if you did travel, you kept yourself safe. If you didn't travel, you were able to have as much fun and as good a time as you could at home, talking to others through social media or long distance and doing what you can. Again, this is one Thanksgiving, this is one holiday season that we need to get through, and then hopefully we get through this safely so the next ones we can enjoy. But in the meantime, this week I hope you have a wonderful week, and like always, I hope you, your family, your loved ones stay as happy and as healthy as you can.